Yes, Vegas, it is that time where we get to talk everything health related on Smooth 98.1. And if you just tuned in for the first time, this is Smooth Health on Smooth 98.1. And my name is Joy Ray. Always a pleasure to talk about your health and how best you can be in tip-top shape, the things you need to do, the things you need to avoid, all that is what we'll get to talk about here on Smooth Health. And today's not going to be any different. However, today we're going to be talking about something that's centered around mothers and children, right? But yes, talking about mothers and children, we're going to be talking about breastfeeding. And this is also to, enlighten people about why breastfeeding is important, also help them have the right support system, a lot of questions that people have, but they're not certain of. And someone who's going to be doing justice to this is my guest. Yeah, so today we're talking about how we can prioritize breastfeeding as well as create sustainable support systems for them. My guest this evening, who's joining me virtually, is Dr. Funmi Yusuf Oghome. She is a consultant pediatrician at Reddington Multi-Specialist Hospital. Good evening, and glad to have with me rather. Oh my goodness, it's how exciting to have you. That's made me so, I don't know, giddy. Okay. Oh,
Yeah,
okay. I can hear you now better. Okay. It was a bit faint earlier on, but good to have you now. Okay, so yes, I know that breastfeeding for some people, they'll be like, oh, breastfeeding is not, it doesn't have anything to do with me. Oh, it's just for the women. And yeah, the mothers would get to sort all that out. But whilst it is important to note that breastfeeding is the essential sustenance for babies, there's a whole lot more to breastfeeding that we're going to be learning of, and why they also need the right support system. And like I said, breaking it down this evening, Dr. Fumi, she'll be doing a whole lot of that for us this evening. Okay, so let's get into the conversation. And really, why is I know that is they drum this into the head of every mother, that especially when you're going through antenatal, they are telling you breastfeeding is important for the baby. Breastfeeding, you have to make sure that you're breastfeeding your and I'm like, it's it's a no-brainer, yeah, but what if? Anyways, let's start off with why is breastfeeding such a big deal, especially when they say for the first 6 months of a baby's life?
thank you very much. If we're aware, this week, August 1st to 7th, is the breastfeeding week.
Mm-hmm.
And the theme for this year is breastfeeding, prioritizing breastfeeding, and creating sustainable support systems.
Awesome.
Feeding is nature's way of preparing a child for life. Actually, breast milk is a child's first vaccine, and it's crucial,
Oh.
especially, oh yes, for the first 6 months, because it provides optimal nutrition and immune
Mm.
protection for newborn babies, while also offering various health benefits for the mother. Breast milk contains all the nutrients an infant will need in the first 6 months of life in the right proportion, right volume, and at the right temperature. It also protects against childhood diseases like diarrhea, respiratory tract infections like pneumonia, otitis media, which is an ear infection, and as well as things as severe as bacterial meningitis. It also reduces risk of chronic diseases on the long term, like
Okay.
asthma,
Mhm.
childhood obesity, and certain types of leukemia. Additionally, it's also associated with a lower risk of chronic diseases on the long term, like type 2 diabetes mellitus, eczema, and chronic inflammatory bowel diseases in later life. And also, it's not just the baby that benefits from breastfeeding or
Oh,
exclusive
okay.
breastfeeding. Oh, yes, the mother also has a lot to benefit. It reduces the mother's risk of breast cancer, ovarian cancer, endometrial cancer,
Mm.
type 2 diabetes, and surprisingly, cardiovascular diseases. That's like heart diseases
Heart disease.
as well as stroke. Yes, it's also been known that mothers that breastfeed have a lower risk of postpartum depression.
Okay.
It also hastens postpartum recovery and helps the mother with weight loss. So you can see that with all these benefits, there's
Mm.
nothing to lose. It's a
Honestly,
for
it's a
mother.
win-win. Oh my goodness. Oh my word. No wonder it's been drummed a song. Well, I hear it a lot. You have to make sure that you're breastfeeding your baby. You have to make sure that you're breastfeeding your baby for 6 months. No water, no other. See, we'll come to that other part. We'll come to that other one because I believe they're humans. And there's certain things I get to ask, and it doesn't make sense to me, but hey, I'm an adult, so I might not understand where a baby's life is impacted with that. But let's even talk about the breast milk itself. So for first time mothers, and they've obviously they've gone through the process of birthing the baby, but it seems as if there's little to no supply of milk coming out. So they're usually worried. Is there something that they're supposed to do prior to the baby coming forth, or is there a technique that could help them start lactating, and so that once baby comes, it's there already, and then baby's suckling and take getting all these benefits from breast milk.
Thank you very much, Joy. Actually, that is actually more of a perceived than a real problem, because
Oh,
nature has made it in such a way that when the baby is born, the size of the tummy is just the right size of the amount of milk the mother supplies. And so as the baby grows older, the size of the tummy enlarges to accommodate the amount of milk that will be coming from the mother. Oh, yes. Oh, yes. And
oh my
so
word. That now sounds very, very odd.
So studies have shown that approximately 75% of new mothers start off breastfeeding their babies, but they stop partially just because of what you said. They're like, oh, they don't think the milk is enough for the baby. They don't think, oh,
Mm-hmm.
the baby's going to gain weight on this, you know. But we have markers we look at. The baby is gaining weight. The baby is peeing the diapers. The baby is getting wet diapers. The baby is pooing. So
Okay.
those are some of the signs that we look out for to know that, oh, this baby is, is getting
Actually,
enough. Yes, getting enough
oh,
of what he needs. Oh yes, oh yes. And oftentimes, very rarely, mothers will have a low supply, and they will actually have a real problem, not just a perceived problem. So
okay.
mothers that have had previous breast surgeries, or some that have
Mm,
conditions like polycystic ovarian disease, and some diabetic mothers, yes, they can actually have a real problem, with
I
breastfeeding.
see.
However, most women make more than one third more of the breast milk that their babies need. And so we actually find some mothers that are breast milk donors, you know, yeah, because they are breast milk banks now. So they
Yes.
donate. Oh, yeah.
Oh my word. I was going to come to that. Because yes, so for mothers who can't, um I, I don't know. I believe there's a process for screening to find out if it's even worth, you know, letting someone else their milk being shared. Kind of feels very
Awkward.
unhygienic and very awkward at some point. So, how does that work?
Hmm. Okay, so we have what we call breast milk banks,
Okay.
because there are some particular kind of babies that um, were discouraged from giving infant formulas. So those kind of babies that were very extremely particular about them getting breast milk, those ones are candidates, particularly candidates, to get milk from breast donors. If for whatever reason, maybe the mother is critically ill, or we have cases
Mm.
in which maybe it's a surrogate mother, and you don't want
Okay.
any bonding between the infant and the mother. We have breast milk banks, and these are well structured systems where
Okay.
this breast milk is screened and
Oh,
screened
okay.
properly. Yes, screened properly and preserved properly at the right temperature for those that will have need of it.
Okay, so now that brings me to okay, so for the regular working mothers, how do they manage breastfeeding? I know you've just spoken about how they can source extra milk from breast breast milk banks, but I've seen where mothers are also, saving some of their milks, putting it in containers, putting it in the freezer and all that. I don't know if it's a freezer. I don't know if it, I'm like, I'm not sure if I've seen anyone put it in the freezer, but I
Both.
usually see, oh, you can actually do both.
Yes.
Ah, how long is that supposed to be for, and how safe? Like, okay, so the transition, if I'm putting it in a freezer, how long is it supposed to be there in there for? And how long am I supposed to, in a sense, heat it up for the baby to consume?
Okay. So there's something called the rule of fours. So 4 hours, breast milk can be outside in the room temperature for 4 hours, in the
Okay.
fridge for 4 days, and in the freezer can be stored for as long as 4 months. Uh,
Ooh,
yes.
okay. That's impressive.
Oh, yeah. So when it's in the fridge, the mom brings out the milk, puts it in lukewarm water because
Okay.
heat can destroy the nutrients. Also, to know
Ah,
that the moment it starts getting frozen, the concentration of the what we call immune globulins and some of the protective properties do not remain the same. Howbeit, the nutritional value is almost exactly the same thing. So it's
oh,
still
okay.
good. It's still as good, even though we prefer it to be best from source, but that is still a better option than the baby
Okay.
taking breast milk substitutes. So for working moms, they can manage it by, preparing ahead. Like those that have short maternity leaves, they can effectively manage breastfeeding by planning ahead and utilizing breast pumps to express and store breast milk. You know,
Okay.
yes, in the early period where the babies are not even taking so much. You can store the excess in the fridge and freezer, as the case may be, in
Mm,
preparation for the time when the mother will not be available.
mm,
Also, there are options of taking their babies with them to work, because there's some facilities that have room for that. They
yeah.
have room for lactating mothers to
Mm,
breastfeed their babies, to pump. They have lactation rooms where they can pump and keep milk and the likes. And some even have crutches around or within their office premises.
mm. Well, that is good to know, because I assumed, honestly, that that would be a problem, especially seeing how, well, some companies tend to sell it that, oh, okay, let's start selling formula to help the mothers who are working. They don't need to express milk. And, there was the notion that once they express milk, it's not safe after a certain period. So that was something that was being peddled for a very long time. And you know how it is. Once a once a woman hears, oh, my breast milk is no longer good, I'm not even trying. I don't want to save anything. My mother says this is how it is. And because we've grown with all that without making our findings, as you just pass it down through the generation without any questions asked. Oh, your mother did not do that, so don't do that. How are you going to be putting breast milk in the fridge? Who says that that thing is good for the child? So those are actually eye-opening thoughts there. So I'm hoping any mother who's listening now, maybe first-time mother, or if you have other kids, you're in the process, it's something you want to take cognizance of and plan ahead. I like the fact they say plan ahead. You know you're going to be doing this, so make the plans and see how your life can actually be easier. Okay, so yes, you tune into Smooth 98.1, Smooth Health here, and today we're talking about breastfeeding. I've got with me Dr. Funmi Oghome. She is a consultant pediatrician at Reddington Multi-Specialist Hospital, and she's been giving so much insight this evening on how on breast milk and why it is absolutely important. If you do have questions you want to ask, you have contributions you like to add, what you can do is share your thoughts with me on WhatsApp. The number is 0911. Oh, okay. I think the network was frozen for a bit. Anyways, hopefully she'll join it back in a few seconds. Well, but if you have any questions you'd like to ask, you have any contributions you'd like to also add, the number is 0911 999 Take that again, 0911 999 That is the WhatsApp number. You can share your thoughts, questions along the line, and yeah, Dr. Funmi will definitely address them as we go forward and have our conversation. I don't know what exactly happened to the network. I think it bounced her off. Hopefully, she'll be able to get back in, and we'll continue the conversation. I don't know what's happening with yeah, I know the network can be a bit iffy sometimes. But as soon as we get her back in, we will continue conversation, especially when it comes to the exclusivity of breastfeeding. I know some people say, okay, it's some people want to do exclusive breastfeeding. Some say, oh, it's best to have a mix of both and all that good stuff. She will be addressing that as well. We'll also touch a bit on, hey, why it's important to even have the baby have the first milk. What does that even mean? What is the essence of that? And, hmm, you know, for the mothers, I'm sure you have a question regarding breastfeeding and when it starts to hurt. How do you manage things? Well, we will be having, we'll be touching on that as well. Let me see how to get her back in. Wondering what happened to her. All right, let's just hold on for a second whilst I try to get her back in.
I'm so
Okay.
sorry.
Okay.
The
All right,
network.
welcome back. I guess network
Yeah.
just well, that's what technology would do anyways. But good to have you back in. Uh okay, so let's go back in. All right, Lagos. Yes, we are still you're still tuned into Smooth Health here on Smooth 98.1, and we are talking about breastfeeding and why we need to prioritize breastfeeding, as well as for the mothers who do not have the right support system, how they can also get the right support system. And my guest, who's been sharing so much insight this evening, is Dr. Funmi Yusuf Oghome, and it's been an interesting conversation we've been having so far. I've been enjoying it. Oh my days. Let's not even let's not even lie. When it comes to freezing breast milk, as I'm one of those people like, is it still good? Is it being in the freezer? So I used to be worried just having that in the freezer for that long. What at least it's good to know that it's not that it's not safe. You just need to know when and how to administer. So 444, that's the number that I'll be going forward with. Okay, I have a question here from Victor. Hi, Victor. Good evening. Victor says he's a father of two, and he would like you to further explain the reason for advising mothers on exclusive breastfeeding. And that was where we're going to, yes, we're going to talk about exclusive breastfeeding. It's usually touted as the best. Why is this? And why is it that, hmm, you know what? Let's just go to exclusive breastfeeding. Why is this touted as the best way to go?
Okay. So first of all, let's define what exclusive breastfeeding is.
Mm.
Breastfeeding is the process of feeding an infant with only breast milk in the first 6 months of life without the addition of anything, not even water. However, can include medications. Yes, if the baby is on medication, it's still exclusive breastfeeding is still ongoing. Okay, so or oral rehydration solution. Yes, but the baby has to be on only breast milk in the first 6 months of life. No water, nothing else added.
Okay, that is
Okay.
that is explanatory.
So for the second part, as regarding why it is important to breastfeed. So they said that in the first 6 months of life, breast milk is actually the baby's first vaccine. The first vaccine that the baby gets.
Right.
And it's because it provides optimal nutrition and immune protection for infants, while also offering various health benefits for the mother as well. Breast milk contains all the nutrients in the right proportion, at the right temperature, at the right time when the baby needs to feed, and protects the infant against diarrhea, respiratory tract infections like pneumonia, otitis media, ear infections, and things as bad as bacterial meningitis. It also reduces the child's risk of chronic diseases on the long term, like asthma, childhood obesity, and certain kinds of leukemia. We also said additionally that breast milk has benefits not just to the baby, but the mother as well, and reduces the mother's risk of breast, ovarian cancer, endometrial cancers, type 2 diabetes, and cardiovascular diseases, like heart disease and strokes. We also mentioned that babies and mothers that breastfeed their babies have a lower risk of postpartum depression compared to others that do not.
That is, I'm hoping, Victor, that you that answers that first question. And he further asks, he says, if a child is not breastfed, does that diminish his or her? Does that diminish him or her in any way? No, I don't think so.
No,
Doesn't.
no, we
Doesn't.
wouldn't say
Any,
diminish the child. So
right.
the breastfeeding has additional advantages for the baby. Of course, there are situations, where it's just impossible, to breastfeed the baby. So that is understandable.
Okay. So one of the things he's also asking is if there's sufficient research that have been carried out regarding to justify why exclusive breastfeeding is important, or it is reason why people talk about it a lot, at least from the medical point of view.
Oh, certainly. Extensive research has been carried out, and there's still more that are ongoing. And that is why the consensus has been reached that exclusive breastfeeding should be in the first 6 months of life, because it has been seen to be sufficient to produce a baby with all the nutrients and all the nutrients that they need for the first 6 months of life, and thereafter introducing complementary feeds. And that breastfeeding should be continued for as long as 2 years, or as long as the mother is willing.
That feels like it's a long
time. As long as the mother is willing.
Okay. Because I know that some mothers just want to immediately a child becomes a toddler and can work. You know what? Away from my my breast. Let my breast be. So here's the thing I'd like to ask. So for the mothers, right? And one of the reasons some mothers have said they are quick to stop breastfeeding is that it begins to hurt. Is breastfeeding supposed to hurt, or is pain a sign that something is wrong?
Okay, thank you for that question. So breastfeeding is not supposed to hurt. That is a common problem, but it is not a normal thing. In other words, it's not supposed to be a painful procedure or, occurrence. However, initially there may be some discomfort, and that may be from, the fact that there's some tenderness, some maybe pain. The breast is heavy with milk, engorged, as we say, So if there may be a bit of discomfort here and there, but it's not supposed to be painful. So when it's painful, it's a sign that it's not being properly done. It's not being properly done.
Okay. Okay. That is impressive. Partly. So if you're not breastfeeding properly, it will also hurt.
Oh, yes.
Now, let's talk about mothers. Yes, we've been talking about the babies for a bit. I'm talking about why they need to be breastfed. How about the mothers? Are there foods breastfeeding mothers should actually eat to help them, produce more milk? And are there any one that they're supposed to avoid completely?
Thank you for that question. So really, they should just focus on having a healthy diet, a healthy and a varied diet comprising of fruits, vegetables, whole grains, proteins, and obviously a lot of water, because breast milk is about 90% water, and you can't give what you don't have. So basically they just need to eat a well-balanced diet and avoid things like alcohol, caffeine, foods that are high in sugar and fat.
Okay. So it's not that there are no there are no specifics, but just make sure that you're eating healthy so you can also produce enough milk for mothers. So what is your advice for moms who feel pressured about how their babies how they feed their baby, especially in a situation where sadly they don't have enough breast milk to sustain the baby, but they want to, and it feels like they're being judged. I've seen certain mothers feel being put in that situation, even sadly in certain um, health facilities. They're judging you like, why are you not producing milk for the baby? So how do they feel? How are they supposed to help themselves in this process?
The truth is, breastfeeding requires adequate practice, patience, and persistence. We will be insincere if we say it's easy to breastfeed a child for the first 6 months of life. And so some women, for whatever reason, are just not able to. But should they feel pressured? No. They shouldn't feel pressure because anxiety on its own, fear, are things that can disturb breastfeeding.
Mm.
It can actually affect a woman's milk output because
Wow.
mental and emotional stress, yes, there are factors, that can hinder a woman's flow of milk. So most importantly, realize that fed is best. Fed is best. Whether you're able to produce milk or you're
Mm.
not able to, as long as your baby is getting fed, that is the best thing for the baby at that point in time. Most
Mm.
importantly, the mother should prioritize the baby's well-being and her own mental health
Mm.
because you need a living mother to breastfeed a child, you know?
Mm.
And one thing we always say is little breast milk is better than no breast milk at all. So if for whatever reason you're not able to meet up with the demand of the baby, whatever you're still able to give, we will still take it. Okay? So if the breastfeeding isn't working or causing stress, or formula feeding or a combination of both is perfectly um,
Doable at that
acceptable.
point. Mm. Okay. One final question before I know I'm out of time already, but one final question. I've heard instances where some babies reject breast milk. Why is this? Is there any science to this?
Okay, so that um in its own, it's not that the baby rejects the breast milk. However, there may be things that are hindering the baby from being able to latch, maybe like a tongue tie.
Oh,
Oh, yes, maybe like a tongue tie. Or sometimes some babies have what we call congenital abnormalities that can disturb the sucking reflex. So if that baby pushes the breast away or is not sucking as he ought to, you may say, oh, it's rejected, but there's actually something fundamentally wrong because babies really do not reject breast milk.
hey, that is really, really interesting and very insightful, if I might say so myself. Thank you so much for your time and thank you so much for the knowledge. I've gained plenty today. And I now understand certain things when it comes to breast milk, and I'm sure that mothers and fathers who are listening will be able to help their partners as they get on this journey. So, how can well, how can parents, mothers who are listening now, how can they reach out to you on your social media handle? How can if they have questions that they're maybe shy to ask right now, but they want further insight on how to take care of themselves, their babies, and so on? How can they reach out to you and ask further questions?
So they can reach out to me on my Instagram handle. That's Funmi Oghome.
All
Funmi
right.
Oghome.
And take it up from there.
FemiogHome.
Thank you so much for spending that out because I'm sure that not a lot of people would have been able to catch that on. But thank you so much for your time and thank you so much for the enlightenment as well. Lagos, it is important to take care of you and take care of your health. But this is where we draw a curtain on Smooth Health today. Next week, Thursday, will be another interesting conversation regarding your health. And as I always say, if you don't take care of your health, it's going to take care of you by itself. So do the most important thing.
Thank you, Joy.
Thank you so much. It was definitely an interesting session. I would